So, not live, we're at the National Rural Health Conference. It's just wrapped up, and here is Geri Malone and David Butt from the National Rural Health Alliance. Can you introduce yourselves? What's your day job?
Geri here. My day job, I work for Crana Plus, which is the remote health organisation. I'm a nurse and a midwife by profession, but my role is in professional development and support for remote staff.
And where are you based normally?
I'm based in Adelaide, not very remote, but travel extensively.
Right, and you, David?
And my day job is as CEO of the National Rural Health Alliance, and I'm based in Canberra.
And how long have you been in that role?
Since October last year. I think I've just hit 6 months.
Yeah.
And you come with a long experience in health policy and politics, don't you? So what are some of your other roles?
Prior to this, I was CEO and Commissioner of the National Mental Health Commission. Prior to that, I was Deputy Secretary, Commonwealth Department of Health, CEO of the Australian General Practice Network, CEO of Little Company Mary Healthcare, CEO of the ACT Health System, a few other jobs in over time.
And when you
I was Regional Director of Peninsula and Torres Strait at one stage, so I was based up here in Cairns.
Right, okay. And so this has been a huge and immersive conference. Why do we have a National Rural Health Conference? What does it mean, do you think, to bring such diverse people together, travel long distances, and such a really wide range of presentations and a lot of art and cultural performances?
Well, I think it's exactly, you captured it all. It's about that diversity, which is really important to have a national forum where we have an opportunity to showcase, if you like, the diversity of what rural and remote health is all about, the different people that are involved, the different professional groups, the carers, the consumers, and through an incredible range of topics, which sometimes is a bit overwhelming for people because it's enormous. And then I think that's just really important, and it's grown enormously. We talked about it. The first one gathering was in 1991, which was a very small group, and it was probably pretty, it was multidisciplinary then, but it's just grown enormously, and I think that's why we need to constantly put it on the agenda of the diversity, how important it is. So, and people come because they see it as being really important.
You, David, what did you?
Yeah, I think the content is really important, and we talk about a lot of very important issues, come up with a lot of evidence about what's working and what's not working. I think the networking and the sharing is hugely important because, as Geri's saying, we've got people from a diverse range of locations, positions dispersed across the country, a lot of them working in relatively isolated areas, and so it's good to be able to network and to establish relationships so that you can, when you've got a problem, realise you're not alone, and that you can actually have others who are going through similar experiences and you can share those experiences.
And I guess every conference has its own vibe. What was the vibe of this conference? Any particular theme or issue or feeling?
I think a lot came out about culture. Was here a lot about culture, which I think was really great, and because there was a lot of an appreciation of cultural safety in the context of Aboriginal and Torres Strait Islander. I think there was quite a theme of that. We had great, not just keynote speakers, but in all of the sessions. So I think culture, community, collaboration, connectedness. I think for me, there was a lot of that, I thought, at this conference, which was an underlying theme, I think.
Yeah, I also think there was a strong emphasis on doing things locally. I mean, particularly with the involvement here this time of primary health networks, 31 of them spread across the country, and we had good representation from them. So I think there's a realisation and there's a sharing about coming up with local solutions to local problems, and the fact that people who live and work in rural and remote areas actually do know the solutions to a lot of the problems that the communities are facing.
Was there any presentation that will stay with you in particular, or anything that changes how you think, or really, gelled or challenged? What was the?
I don't know about challenged. I think it resonated for a lot of reasons, and maybe just the messages that came through for me. And I think for me it was around the cultural safety, which is something that hopefully over the years of practice I know and understand, and it's so important, and I think that resonated. Sister Anne Gardner, of course, I think she set the agenda right back on that first night, in such a brilliant way about that respect and empowerment, and so I think they resonated with me. But a lot of things did. The arts, there's just some fabulous presentations. The commitment of people in the arts and how that can just make such a difference to people's lives. And I think they were talking about their programs, but I think everybody in the audience, you felt, got something out of it as well, just to be in the moment of them doing their presentations.
Very much the same. I mean, Sister Anne was terrific. I also think Janine Mohammed talking about cultural safety and talking about what she'd like the world to be like for her grandchildren in 20 years' time, and reflecting on where she'd like things to be by 2037, I thought was very, very powerful in the way she presented that.
Now we come to the take-home recommendations from the conference. Would you like to tell us what the key ones are and what happens next with them?
Well, this process, I guess, might be good to explain how, and it's always been but it has been a feature of this conference that to go away with something is really important for the delegates. So an opportunity for them to make recommendations, things that come up in sessions that are important to people. And so we've had the sharing shed for some time, where people are able to put in recommendations about things that are important, and particularly smart objective sort of basis. It's about the as Tanya Lehman, who put them coordinated that process, it's about the I, what I can do, what we as a team can do, and then what they can do. So to put your recommendations. So we've come up with 7 themes. That doesn't mean the ones that we've printed out are not all of them. They're only just the ones that emerged as themes from a whole lot of others. So,
right.
Yeah. So that's the 7.
Yeah.
And what happens to them?
Well, we take them away. We've presented them to the Minister, so that's one part of it. We'll take them away and work them up further. We'll see how much of that we can fit within our strategy as the National Rural Health Alliance, and then pursue that in a policy and advocacy sense. But in many ways, they're also there for all the delegates and the different organisations and all our members. So very much we would be expecting that they will use them locally, that they'll be talking to their communities, to their organisations, to their local politicians, and saying these are the priority areas that we want to pursue, because we're really looking for a groundswell of support for action to be taken on a range of issues that came out of the conference.
I must admit, and you probably won't be surprised if you read Craigie, but I was surprised there wasn't more of a focus on climate and health at the conference, as well as in the recommendations. What does that speak to, do you think, that sort of gap, I guess?
Yeah, I mean, it's an issue that did come up actually in a number of conversations that I had, and did come up in some of the recommendations, but it wasn't an overriding recommendation that was coming out from delegates, that's for sure. But it is something that we're engaged in terms of climate change and looking at the impact of that in rural and remote Australia, so we're part of it.
Yeah, that is interesting. Well, I'm sure they're in there, but I think it's I think that is also just indicative of how many issues there are, and not saying that it's not, because it's not there, it's not recognised by people and important. And we're very clear, and we're very that these come from the delegates. It's not something we are sanitising and putting in because it's, for want of a better word, politically correct to slip something in that we should be. We're really committed to the fact that this is from the delegates of the conference. But I don't think that means that it's not something that's in people's minds, but it is interesting that it didn't emerge as one of the key themes.
And next stop, Hobart.
Yes.
What would you hope might have changed by, what year is Hobart?
2019.
19. So in 2 years' time, where would you like to be?
Well,
what might have changed?
Our first recommendation was about the need for all governments to work together on the development of a national rural health strategy and an associated implementation plan, and we were asking for that to be done by June next year, which is a relatively short period of time in terms of a national plan, but it's a bit of a glaring gap at the moment that we haven't got such a plan anymore on rural health. We had one for almost 20 years, we haven't had a plan since 2011. So we think if that can be in place, that will form the framework for a whole range of other things that have to happen. In an area such as digital you would be hoping that the NBN had been rolled out successfully and people were getting equitable access to it. That would be a good start for a lot of things that we want to achieve in rural health.
Yes, yeah. I think the National Rural Health Strategy is so important because so much can come from that in terms of, you know, having a consistent approach to things and opportunities for everybody to be going in the same direction. So I think that is one of the critical ones, as well as, you know, obviously a lot of the others. But yeah. I think research is also very important. Evidence-based practice and workforce, of course, is always going to be important to us.
Yeah, so by the time of the next conference, you would be hoping that the move to the National Rural Generalist pathway for general practice will have been completed and that they'll have moved on to allied health and nursing and other areas in terms of rural generalists. So they're having a generalist team-based approach.
Great. Well, anything else that you'd like to add?
No, thanks.
I think
Good
we
time.
can call that a wrap of the conference then. Thank you both very much for your time.
Thank you.